In this video, I want to talk about the drugs to treat essential tremor. So essential tremor, also abbreviated as ET, is a posture or action tremor. It's very apparent when the arms are outstretched. And also it gets worse at the end of a goal-directed movement. So if you give someone a glass of water at the end of a goal-directed movement, that's where you see it very clearly. And again, remember also when we're talking about movement disorders, Parkinson's disease, another disease where a tremor is apparent, that's a resting tremor. Here we're talking about a tremor that gets worse when you have a goal-directed movement, so an action tremor. I also want to mention that this tremor is relieved usually by small amounts of alcohol. And that gives us a clue in terms of treatment, because alcohol affects the GABA A receptor, so that's the target A for alcohol, GABA A receptor. And many drugs that we use to treat essential tremor are also going to affect GABAergic signal transmission. The first line drug for essential tremor is propranolol. So unfortunately here it doesn't work. So that's a first line drug. Then we can use some anti-seizure medications. One is the drug primidone. That's a barbiturate. And then topiramate does a couple of things, but also enhances GABAergic transmission. And then we can also use benzos. And they also affect GABAergic signaling. So this is just as a brief overview. Now we're going to go into the different drug classes. Now our first line drug for essential tremor is propranolol, a non-selective beta blocker. It's an OLOL, so we all know it's a beta blocker. It's actually pretty lipophilic. It's one of the most lipophilic. It passes the blood-brain barrier, BBB, and it blocks beta receptor in brain and also skeletal muscle. So there's definitively central effects involved why it works in essential tremor, but maybe also we know that there's beta 2 receptors on skeletal muscle that make us have this tremor when we are kind of in fight or flight, when we are running away from a lion. So maybe this blockade of this skeletal muscle beta receptor helps also. Many indications, I hope you can name a couple of others besides essential tremor, a lot of cardiovascular indications for beta blockers. Adverse effects, good opportunity to review some of the adverse effects. So I hope you remember it can cause bradycardia, so it's going to decrease heart rate. We could even get an AV block because we decrease AV conduction. We can get hypotension because we lower our blood pressure. They were used or are still used for hypertension. And then we can also exacerbate asthma because, again, we are using here a non-specific beta blocker. So we also block the beta 2 receptors on the bronchiosmooth muscle. So not a good drug for a patient with asthma. Also, as a quick reminder, beta blockers can be used for performance anxiety. And this helps a little bit in terms of the mechanism of action and essential tremor, because performance anxiety, we also kind of have a bit shaking and increased heart rate and so on and so forth. What are some other drugs to treat essential tremor? So we have 2 anti-seizure medications that are used, and the one is primidone, which is a barbiturate, which also works very similar to the benzos. It binds to the GABA receptor and then has a conformational change so that we can potentiate GABAergic signaling. Makes us very drowsy and fatigued, like everything that acts on the GABA receptor. Another anti-seizure medication that is used for essential tremor is topiramate. It has some action on the sodium channel, but also enhances GABAergic transmission, which brings us back to this concept of GABAergic signaling being somehow important for essential tremor. We can use it for seizures, but also for essential tremor. Makes us also pretty drowsy, fatigued. And for topiramate, we should also remember some cognitive problems when we use this drug. Another option for essential tremor is to use benzodiazepines. So these are the drugs that end on PAM or LAM. And here an example that is often used is alprazolam. And we already discussed in another video how benzos work. So they bind to this allosteric site at the GABA receptor. And then you're going to have enhanced GABAergic activity. They have many, many indications. I hope you can name a couple of Like you can use them for the treatment of insomnia, for anxiety. You can use them as spasmolytics. You can use them as anti-seizure medications. Many adverse effects make you very drowsy, fatigue, mood impairment, slowing of thoughts. And then also there's always a risk of dependence. Now for essential tremor, sometimes the tremor gets worse with anxiety. So if you have a patient with anxiety and essential tremor, that's certainly a drug to think about. Thanks for watching this video on the drugs to treat essential tremor. Bye-bye.